Somebody can just call 911. Then do, hello, there's fire, there's fire. Where is the fire? My pocket. Hello. So in Ghana, sometimes there are prank calls. Somebody will make a call, I want to commit suicide. Okay, where are you? They will tell you, the place they will mention to you, I mean, they realize that this person is joking. But I mean, there are actually call lines that you can call and then you can actually get help. Then it's also important to make an appointment with your healthcare provider or professional. So here, what is important is that the thing about mental illness or psychological problems is that family support is very key. Because at the time when you are going through this crisis, you have no control of yourself. Because, I mean, if you have control, you wouldn't be doing some of the things that you are doing. So family support is very, very key in management and treatment of mental illness and then men with suicide. So we are saying that get help when you need it. Asking for help can be hard for men, but without treatment, depression isn't likely to go away and may get worse. It is very difficult for men to ask for help. Even if a man is financially, if he needs some money to buy something, it's very difficult for him to ask his friend, the other male. So the same thing applies. When they find themselves in that situation, it's difficult to ask for help. But then once it is depression, it will not just go away like that. You definitely have to go through some form of treatment. Definitely. So untreated depression can affect your health, career, relationship, and then your personal safety. I know people who were in certain relationships and today they are no more as a result of certain mental health conditions. Not depression per se, but certain mental health conditions. I know of some facilities who have staff with mental health conditions and then to some extent, some of them are not even coming to work again. Some of them, you find them even on the streets. So it will affect your health, it will affect your career, and then your personal safety. Your personal safety in the sense that once you get to that stage and then there's something we call hallucination. You start hallucinating, you start hearing voices, you start seeing things that nobody sees. Then the voice tells you that, walk out. Let's say 12 a.m., 1 a.m. The voice tells you that, you just walk out, just be going. I mean, there can be a drunk driver or someone driving and then this is where it affects you personally, your personal safety. You can be knocked by a car and then that might be your end. So depression, even if severe, usually gets better with medication, counseling, and then talk therapy. So some of the people with diagnosis of depression, I mean, they're very mild ones. Some people, their depression is as a result of, let's say, lack of funds. They don't have money or there's no job. Get this person some money or job. It's fine. So for these people, what we do for them is that we have counseling or psychotherapy sessions for them. We counsel them on ways or means that they can get something to do for themselves, or we try to support them or link them to people who can support them. So the social welfare also plays a role. Then with the people who have the severe forms where they are hallucinating, where they are aggressive, where they have suicidal thoughts, we give certain medications. We call them antipsychotics. So we use antipsychotics to treat people with depression. It comes in different forms and different types. Just like there are normal medications like people with diabetes and hypertension also take. And then we have some forms, some also come in the form of injection. We give some in the form of injection. The very severe ones, we use injections and then the orals. So also, it is a sign of good strength, not weakness, to ask for advice or seek help when you need it. Most of the times, or mostly, once you start asking for help, it means you are weak. In the Christian setting, even some people will say that your faith in God is low, or you don't have faith. Once you start talking about things like this, it means Hosemela Siu. So people will not want to talk about it. But this goes beyond faith. In the Bible, there were some of the men of God in the Bible we can talk about. We can talk about Elijah. We can talk about even Jesus Christ. Jesus Christ, at a point when he was going to be crucified, he said or he wished that if it be the will of God, this cap be taken off his head. So it means he also went through some form of psychological anguish. So you don't have to see it as a weakness or a sign a sign of failure. No. It is something, it's a medical condition that can happen to everyone. So we are saying that talk to your healthcare or mental health professional today. Many effective treatments are available. Don't try to deal with male depression on your own. The results could be harmful or tragic. So there are some coping skills that men can actually adapt. So with a mental health professional, treatments can help you to learn how to track your emotions and coping strategies to improve them. So we can actually help you to track your emotions. You should be able to tell when you are feeling some way. When you start experiencing certain signs or you are feeling certain ways or when you start having certain thoughts, then you know that you are getting there. So there's a man just on Tuesday, he used to come to the facility himself, but that day he called me and said he wanted me to treat him in the house. So apparently what happened was that when I asked him, he said he started noticing those signs or the things that happened to him, and then they bring him either handcuffed or in a very bad state. So we can help you track. So it means that he's been able to track his symptoms, and then he can tell when to go for help or to seek help. Then also manage stress through meditation, mindfulness, and then problem solving. Many men actually go through a lot of stress. And the other aspect is that we do not manage our stress. We don't do anything about it. We take it as a normal life scene. But stress these days is doing a lot of miracles. Stress is doing a lot of miracles. People come to the hospitals, we run all labs for them, everything is fine, but they are sick. You ask them, okay, you go and rest for some time. Take some leave off work. Give them some 4 days or 7 days, they are fine. So it's important that we manage our stress. These days, I think lately Trafalgar established, or they opened a center at where they were keeping the COVID, where they were treating the COVID cases at the time. I don't know, when off the Aplau Road. So they have a wellness clinic where they have music therapy. So you see people go there, they leave work, everything, they are in a very relaxed state. They listen to music. Some, depending on the genre of music that you prefer, you get it, and then it's making or it's helping a lot of men. So you also adjust your thinking and try to approach new situations. There's a way that you handle certain stressful situations. But it's important that as men, we can try new approaches. If you realize that particular one is not working for you, if it's alcohol you have been using to manage your stress, for a long time you see that you are doing it, but still it keeps going. It's important that we look at changing the approach. And then you clarify what matters most, and then you set realistic goals and prioritize goals. So it's important to have a scale of preference. No pressure. These days there's a lot of pressure on the male child. Our colleagues, our friends are, I think last year, Richard Niyama, RNQ. You know him, right? He organized a 40 years birthday party. I'm sure you all saw it. You saw the pressure. So some of us, when we're approaching 40, we are like, hey, this guy, the bar he has lifted, what are we going to do? I mean, that shouldn't be a pressure to you at all. We are all different. We are different people. You shouldn't let someone's pressure make you go through that. No. Just do what you can do at a time, and then you move on. And you set realistic goals. You are a civil servant. Your salary is, let's say, 3,000, 4,500. You set goals. You want to build a mansion. You want to have a swimming pool at the top. You want to do this 3D. No, please relax. Take it easy. Okay? Set realistic goals. Because some people, once they target that, that's what they want to do, and they are not able to do it, then what happens is that in the brain, I spoke about some neurotransmitters. They tend to start to play. So when there's this imbalance, then you see him the next time, he's moody, or they said they saw him walking on the street, he's talking to himself. That's what happens. So seek emotional support and build social connection. I think this is a very healthy social connection. So it is important that you build healthy connections or groups where you can talk about some things, some of these things freely without any reason to be afraid or ashamed. Then it's important to stay active, keep a regular schedule, and make healthy choices.